Hello, my friends. Welcome back to the Fertility Confidence Podcast. Thank you so much for pushing play and hanging out with me today. We are talking all about when should my partner get labs done? And I see this question in my DMs a lot, especially for those of you who are in the 8-month or less range of trying, right? If you're under that year of trying, you're likely doing research, you're tracking your cycle, you're making adjustments and changes to your life. And if you follow my content at Fertility Confidence Method, you'll also see that we are huge supporters of a whole couple approach. So sperm is 50% of the equation, meaning if you're looking to boost and optimize your fertility, we can't ignore that side of things because your body, your egg, your uterus is really only just half the story, right? So the really short answer to this question is immediately, right? If you've followed me for any length of time, you'll know that I do not subscribe to this notion that you need to be trying for a year before you can get testing or before you can get support. I think that this weird rule we seem to have developed in medicine is doing couples a huge disservice because no, not necessarily do we need you jumping into medicated cycles right away when you're the second month of trying, but we do want to use our time effectively and wisely to optimize your bodies to get pregnant. And not everybody really starts prenatal care prior to trying to conceive. A lot of us just make the decision that it's time to try and we're going to go for it and assume it's going to be really easy. And you start taking a prenatal because that's just basic knowledge. And as the months tick on where it's not working, that's where you start finding the information on Instagram and TikTok and Reddit and the internet around what else you maybe should be doing or what you should be thinking about. And the general consensus in the fertility world is still a very female focused conversation. And unfortunately, it's not always about taking a whole couple approach when we know that it needs to be. That is 100% a necessity. And I will say inside Fertility Confidence Method, the more male support we add, the better outcomes we have. And the more we can get our male counterparts buying into the plan and buying in to the concept of optimizing their fertility, the sooner they get pregnant, the sooner we're getting good results. So ideally, we're getting testing done immediately. Now, I understand that it's not always that simple, right? You might have some roadblocks, i.e. your family practitioner, i.e. your partner's family practitioner, or your OBGYN, whoever you're working with, just not being willing to run a semen analysis because they don't think that it's really warranted at this point. But at the end of the day, you are your own best advocate. And so the best advice I can give you is really to advocate for this in a proactive way. And I think the best way to come about it in a clinical setting is saying, listen, I understand that we haven't been trying for a year yet. And I know that's generally when we start to do testing. However, I'm really trying to be proactive with my healthcare. And it would bring me a lot of peace of mind to have these results and answers now so that if something is wrong, we can actually start actively working on it. Would you be willing to help us out by ordering this test for me? So you're kind of acknowledging that you understand you're asking them to, not follow the general guidelines, but you're doing it because you're trying to be proactive. And I don't think we should really be penalizing anyone for that, honestly. And another huge issue I see in terms of roadblocks with getting a semen analysis is a lot of times couples maybe are actually getting testing and labs ordered and done through their practitioners, or we know that there is a female-centered diagnosis in terms of infertility. And once we have that, it's like nothing else matters, right? We see this all the time with clients. They'll come in, they'll be trying for 8 months, 10 months, a year, however long, and they know they have PCOS, or they know they have endometriosis, or they know they've had a diagnosis, a clinical diagnosis given by their care team currently. Then because of that, their care teams basically turned a blind eye to their partner saying, well, it's definitely not a you issue because we know this person's not ovulating, or we know that this is a roadblock. And that also is doing couples such a huge disservice. Why? Because 33% of infertility cases are both male and female factor combined, meaning A third of cases is both of you, a third of cases is male, and a third of cases is female. So when we're looking at female, we're looking at over half. And when we're looking at male, we're looking at over half if we're kind of dividing it out like that. So if we're ignoring sperm because of a female factor diagnosis, we are still potentially missing out on another roadblock. We're potentially missing out on a red flag. We're potentially missing out on actually optimizing that fertility potential. So if that is a part of your journey, again, we're going to advocate, right? I understand that we are aware that XYZ is likely part of our story, but we haven't actually tested my partner yet. So do you think we could run some testing there just to make sure there's not something else we're missing, right? If we're coming at it from a very just like, I acknowledge, the flow of things, but also you get to decide when you want these answers. You do not have to wait. And that brings me to my third point of if your current care team is truly, truly not willing to run a basic semen analysis, then there are some at-home options. I would love you to go and have drop off a clinical sample with a lab that is analyzed right then and there. I do think that we're going to get better results from that type of testing. However, in this line of work, that's not always accessible to us, unfortunately. Myself, as a naturopathic doctor here in Ontario, I can order a semen analysis for Ontario clients. However, there are very few labs that will actually take a sample dropped off from my requisition, meaning there's a roadblock to location. You have to have it analyzed within an hour. So there's not a lot of opportunity or options for myself to be able to order them for clients. And we have to use other means. But then if you're running into that roadblock with your current care team, know that there are at-home options. We personally love recommending Fellow because they're one of the few options that also looks at morphology. So we want to see concentration, motility, morphology at the very least. If you've done an at-home option before and the numbers are really bad, my kind of consensus and general rule of thumb is let's not panic yet. If the at-home options are really bad, if anything, this is something to take to your care team and say, we did this on our own. The numbers are not great. We would love to confirm them with a clinical sample. And hopefully they'll be more willing to dig deeper with you because it's not a perfect system, right? Flash freezing and shipping and thawing. And there's more room for error in those situations. I'm not saying that the at-home options aren't valid. I'm just saying there's definitely more room for error. So if the numbers are terrible, before we totally panic, let's confirm that with a clinical sample and just see what those numbers say as well. I have seen discrepancies when we compare those two. So something to think about, okay? When you're TTC, one of the big factors most women want to know is how to improve egg quality, right? It's the big question. One way we can support fertility outcomes is by improving egg cell health and mitochondrial health. And beyond nutrient, beyond lifestyle factors, adding some extra antioxidant support to your supplement routine can just be that little extra bonus for you on your fertility journey. Needed's egg quality support product combines research-based ingredients in a way that allows them to work synergistically together at therapeutic dose, which is so important. And it's recommended to combine their egg quality support product with the CoQ10 to ensure that you are still getting everything at the correct dosage, which I love. You can find both products over on their site at thisisneeded.com, and remember to use the code Dr. Kelsey to get 20% off your first order. So we want to get that semen analysis. We ideally want to get that done as soon as possible. I've had some clients back in the day when I worked in a clinic and I did a lot of not just fertility care, but just preconception care. A lot of my clients who came to see me for other things then transitioned into trying to conceive. So we spent 3 to 6 months preparing their body. I had clients and couples who were wanting to run a semen analysis even before they started trying to conceive. Good luck getting your doctor to order you one before you're even TTC. But honestly, if that's the information that you want, there are ways to get it. And you really just need to be your own personal advocate on this journey. What I want you to do after you get your semen analysis. So If you're curious what the numbers mean, we have Fertility Labs 101 that doesn't just walk you through semen analysis numbers, but I bring you through the research that we use that looks at optimal levels, because the reference ranges for a semen analysis are pretty hot trash. They're not good. Okay. We have very, very low standards when it comes to reference ranges in terms of a semen analysis. And why? Because reference ranges are just population average. And we know from the research that male fertility is declining. So our population average is declining, and therefore we're comparing our numbers to a bunch of infertile men. It's not great, right? We don't want okay numbers. We want optimal numbers. So if you're curious on how to interpret your semen analysis, what that looks like, Fertility Labs 101 walks you through that. It also walks you through male blood work as well as female blood work, ultrasounds, the whole gamut, what they mean, what we want to ask for, what those numbers should be in both Canadian and American units. You can grab that for just $17. I'll pop the link in the show notes for you. But what we generally want to do after a semen analysis, if numbers aren't optimal, is then we're going to do blood work. We want to look at various things that might be impacting your concentration, motility, morphology. And we also want to advocate for a urology referral. We want a proper workup that includes a scrotal ultrasound, because 15 to 20% of men have something called a varicocele, and that can actually block the ability of sperm to get into the semen. But 40% of infertile men have a varicocele, either on one side or bilaterally. 40%. So this is something that needs to be looked at if concentration or motility, and even I would argue morphology, all three of them, if any of them are low, if semen volume is low along with those numbers, we want to be ruling this in or out. I will say, like, if we took a poll with our clients, it is quite common. I would actually probably agree with that 40%. And having a varicocele surgically repaired it's basically just vein dilation, right? So having that surgically repaired, it's not a guarantee that it's going to fix things. And I would say the research is kind of murky, but we do have positive research with seeing improvements in numbers and improvements in pregnancy rates post-surgery. But it can take 3 to 6 months. So it's another reason why we just don't want to wait, right? If we wait a year to get a semen analysis, then we find the numbers are low, then we maybe wait another 3 months to see urology. Then we get our results back. We find a varicocele. Maybe we wait another couple months for surgery. Now we're really not seeing any good change from that for another 3 to 6 months. Like we're at year 2 at this point now, before we're able to try again with potentially different outcomes. So this is what I mean when I say that the 12-month wait rule really does couples a huge disservice. But for both male and female factor fertility, but especially for male factor fertility, because there's so much we can do to improve sperm numbers. And if we know what we're dealing with sooner rather than later, we can really tailor your approach for you specifically. So if you have some of this information already, and maybe you're not ready to join Fertility Confidence Method and come in and get like a full supportive plan. We do daily office hours. We have an amazing community. It's a great place to hang out, but maybe you just want some male fertility support. We actually do have an offshoot program called His Confidence, and it goes through all the testing that's in Fertility Labs 101. So all that's included for the male side and His Confidence. But then what do we do about it? Right? We talk about nutrition and lifestyle, basic risk factors. How do we make those changes? And we also talk about supplementation, and I share the research around different supplements based on what we have and what we see in a semen analysis. So those links will be down below for you. We do all this process inside FCM. Obviously, we're the ones putting the plan together for you for both partners, for both female and male partners. Inside FCM. But if you're looking for just the male support, His Confidence is a really great place to get that. And I think that the first thing you need to do is, if you haven't had testing, even if you're under the 1 year mark, is to really strongly advocate for it or seek it out. If your doctor's not willing to do it, find a doctor who is. And I think this is like a big, people are like, oh, but you can, you're allowed to shop around. You're allowed to look around for different options. There are different types of doctors. Like I said, I can order semen analysis here in Ontario. Functional medicine doctors can order semen analysis, find a naturopathic doctor. Like, there are a lot of options. You're not pigeonholed into this concept of the conveyor belt system in mainstream medicine. We want to maybe get on the conveyor belt, right? We want to maybe continue through that process. Absolutely. Because eventually we might need the fertility clinic. We might need some of the things that they offer us. It's not one or the other. It needs to be a synergistic combination of both. And the beautiful thing about, what I do and why we have the podcast and YouTube and Instagram is because I really do think there's still a lot of people out there that don't know that don't know that they can seek these things out, that they don't have to wait, that they, there's lots of things you can be doing to improve and support your body on the fertility process. And so I'm going to continue to just spew that out into the world, because even if it just helps 5 people make different decisions and earlier decisions and potentially shorten their fertility journey, I've done my job. And this is a big, big factor in terms of shortening your fertility journey, because so often the men are just forgotten about it for a wide variety of reasons. We actually talked about this from a mental health perspective in the previous episode. If you haven't listened to that, and especially shared that with your partner, I highly, highly recommend it. I think it was a great episode with John. And we talked about how in the fertility clinic space and the fertility journey that men just often get left behind, and not just about testing and treatment, but in a whole variety of ways. So you want to be an active participant in your fertility journey. You need to be an active participant in your fertility journey. And that might mean that you need to stand up for yourself and advocate for quote unquote earlier testing. I don't believe it's early. I don't think there's ever a time that's too early to get testing. And there's never a time that's too early to get support. We have couples come and join us in FCM who've only been trying for 2 or 3 months, but they want to be proactive and they don't want it to take 2 years. So they're going to make those decisions earlier. They're not going to just linger and fester and continue doing the same things that aren't working. And this is where, getting support, I think, is so important when you are ready, right? When you are ready. Maybe you're not there yet. That's totally fine. That's also why we have little bits and pieces of information for you to pick apart at as you need it. That's where Labs 101 comes into play. That's where his confidence comes into play. So I'll pop those links down below for you. Hopefully this was helpful in terms of just letting you know that it's okay to ask these questions and ask for what you want and desire, even if it feels early or even if someone's telling you that it's too early. And hopefully if you get the ball rolling sooner rather than later, if there are things to uncover, we can work on it and see impactful change and get that positive pregnancy test sooner rather than later. So hopefully this episode was great. Share it with your partners, share it with friends and family that are maybe in the same boat as you, because that helps the algorithm get the podcast out for other listeners who are looking for fertility advice, help share some of this amazing knowledge. And I will see you guys in the next episode.